All right, well, we have been telling you about a surge in COVID hospitalizations among children. Doctors are also seeing more pregnant women hospitalized with COVID. The CDC reporting about 1,000 new cases per week in July. Joining me now is Dr. Jessica Shepard, OB-GYN and Chief Medical Officer of Verywell Health. Good to see you.
Good to see you as well. Thank you for having me.
So, Dr. Shepard, let's talk about why this is happening, why these women are coming through with COVID. Are they vaccinated? Are they unvaccinated? What's going on here?
Now, when we look at the actual rates of hospitalizations for pregnant women, you're going to see that the majority of them in the high 90th percentile are unvaccinated. And that's why we are really making the message of getting vaccinated, even in pregnancy. The CDC recently recommended that vaccination in pregnancy is highly recommended and that they should be. This is why we're seeing this surge.
So what are some of the most common questions or maybe fears that you're hearing from pregnant women about getting vaccinated?
Now, during the pandemic and also with the recent advent of the vaccine, you do see a lot of misinformation. Now, for pregnant women, obviously, this is a very stressful time that they're going through, but they also want to make sure that they are being safe for their baby. Now, some of the misconceptions and concerns that I've heard of, will this harm my baby? Even if I'm breastfeeding, will this, transmit through the breast milk and harm my baby? And so this is why it's important that we do have studies and that we do all the research that's required in order to make the best recommendations. And that's what we've been able to say now, is that the vaccine is completely safe for those who are planning for pregnancy in the future, who are currently pregnant, or are breastfeeding.
We've heard about how the vaccine offers antibody protection for baby through breast milk. Can you explain how that happens and actually what it means as well?
Absolutely. So when we think of someone who may have been infected with COVID and they produce antibodies, and that's how they have a natural immunity or defense rather to the disease, we also see that in vaccine. That's really what we call active immunization, where we're actually telling the cells how to respond and fight off COVID. Those antibodies that form, which is why our bodies are so beautiful, is able to be transmitted through the placenta most times to the baby, so that they too can have antibodies, which is also helpful for them to, again, thwart off any disease in the future.
So now let's say a pregnant woman gets COVID, illness. She gets sick with COVID. What are your major concerns as her doctor at that point?
Absolutely. This is exactly why we are seeing an increase to ICU admissions currently, is because it's the perfect storm. When we think of pregnancy, there's already going to be a decrease on the ability for the lungs to be able to oxygenate. So when you have something, a virus, namely, that's really going to hit that respiratory system, you're going to see much more ICU admissions, intubations. I'll even give numbers. Sometimes that helps, is what we're seeing with pregnant patients who are COVID-19 positive and have the disease are going to have more likely severe disease, 15 times more likely to die, 14 times more likely to be intubated, and 22 times more likely to have a preterm birth. So these are the numbers that we're seeing, and these are the numbers that we are seeing in the ICU, and that's why it's so ever important to still have that message of getting vaccinated even in pregnancy.
Yeah, and I hope that we've gotten that message across. Before I let you go, Dr. Shepard, I got to ask you about this new abortion law in Texas, banning abortions after a heartbeat is detected, and we've been saying that can be as early as 6 weeks into a pregnancy, when many women don't even know they're pregnant. Based on what you've seen in your practice, I'd love your thoughts on the impact that this legislation may have both in the short and longer term.
Yeah, taking this is so controversial when we think of this Texas law that really has banned abortions at 6 weeks. You said, again, most women don't even realize they're pregnant at 6 weeks. This coming from a physician, a women's health expert, and also a mother myself, I know that reproductive health is so very important. And so this law really takes away that ability for women to make decisions for themselves, for their body. But also in the country, this is something that we have not seen since Roe versus Wade, something so unprecedented as far as what that ban is going to block and the legal challenges that it's going to allow people to have and face when they have issues and making the decision for themselves, and even going as far to someone who may help them. That person too may be implicated when it comes to lawsuits as well.
Dr. Jessica Shepard, thanks for your time today. I really appreciate it.
Thank you.